Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our special guest today is Lauren Castle, founder of the Functional Medicine Pharmacists Alliance. We'll be back with our interview after this brief message from our sponsor.
Hey there, listeners. It's your host of the weekly podcast, Redefining Medicine. I have a question for you. How much time do you spend ordering functional lab tests for your patients? Ordering from multiple lab companies for hundreds of patients can quickly turn into hours of admin time. But there's a new way to order lab tests that I'm excited to share with you. Rupa Health is a tool that lets you order 20 plus specialty labs in a single portal. You can order all tests you normally do from companies like Dutch, Vibrant, Genova, and Great Plains, and so many more. Imagine you're ordering a hormone panel for a patient that includes tests from 3 different labs. You have to log into 3 different websites to place separate orders, and then come back weeks later to check tracking number and download results. Rupa eliminates all of that by having all ordering, tracking, and results in a single place, and they also handle invoices, tracking shipments, automated follow-ups, personalized instructions for completing tests, and so much more. The best part about Rupa, it's free for all practitioners. Go to rupahealth.com, that's RUPA health.com, to join a live demo or sign up to see how it works. Now let's get back to today's show.
We are so pleased to welcome Dr. Lauren Castle to the podcast today. She's a pharmacist trained in nutrition and functional medicine, and she founded the Functional Medicine Pharmacists Alliance. How cool, welcome. So nice to have you.
It's great to be here.
Great, well, I'm curious, what made you want to become a pharmacist in general?
So I knew that I wanted to be a pharmacist very early on. I remember going through my mom's medicine cabinets, and she had all kinds of medications, but also a lot of herbal medications as well. So I remember taking ginger when I was little, and I had a tummy ache. So I think I got my start in integrative medicine very early. But I actually ended up working for an independent pharmacy whenever I was in high school as a technician, and that's really what solidified my decision to go to pharmacy school. And I went to Ohio Northern University, graduated in 2013, and had worked in retail pharmacy for the last 10 years until I discovered functional medicine.
That's interesting. You're an Ohio girl, so am I. Ohio University.
There you go.
So what steps did you take to found the Functional Medicine Pharmacists Alliance? That's a big deal.
It is. So I discovered functional medicine about 5 years ago through my husband's own health journey. And at the time, I was trying to help him get better, but he was having all sorts of brain fog and fatigue, digestive issues, sinus issues, all these different things. And no matter what I did to try and help him eat better or lose weight or exercise or even try over-the-counter remedies, nothing really seemed to make his symptoms go away. And so we discovered functional medicine at a local clinic, and within just a few weeks of him beginning a program and going through all sorts of testing and supplementations, doing an elimination diet, it was pretty miraculous just how quickly his symptoms all cleared up. And so from that point, I was sold that this was absolutely the future of medicine, but we didn't learn these things in pharmacy school. So as I began searching and researching for answers, I really couldn't find anything that was specific to pharmacists. And so I ended up pursuing my education through University of Western States and did their nutrition and functional medicine master's program, and then started trying to educate my own colleagues on what is functional medicine, how do you do it, how do you get started. And so through that, I was speaking at some pharmacy conferences, and there was so much interest in it. So we started a small little Facebook group just to keep in touch with those different pharmacists that were attending. And within 2 years, the group grew to over 1,000 members. So after that point, I realized that there was really this critical mass of pharmacists that were passionate about functional medicine, and that is how the Functional Medicine Pharmacists Alliance became in existence. So we officially founded the group in 2020 and launched the membership, and now we're up to 2,500 pharmacists.
Wow, that's amazing.
Yeah.
Congratulations.
Thank you.
If someone would like to know more about your organization, where should they go?
So you can find us online at fmpha.org. We're also on Instagram and Facebook, so you can look us up there as well.
Can you tell us a little bit about your role with us?
Yes. So as I mentioned, there are tons of pharmacists now that are really starting to embrace functional medicine. But as I started getting into this space, I also realized that a lot of functional medicine practitioners really don't know what a pharmacist has to bring to the team. So here at A4M, obviously, there's lots of pharmacist members who are compounding pharmacists and have been in this space, in bioidentical hormones and all of those types of therapies for many years. But the role of pharmacists is also expanding. And so outside of the compounding world, there's lots of other things that pharmacists can do to help provide functional medicine services to patients, and especially make it more accessible and more affordable, because for many patients, it can be difficult for them to get in to see a functional medicine practitioner or to be able to afford it. And so for pharmacists who can get training and education in functional medicine, there's a lot of different avenues that they can work in, whether it's compounding or traditional retail stores, or perhaps working as a consultant pharmacist or doing telehealth, or even working in physician offices and doing collaborative practice agreements. So many different avenues for pharmacists to practice in, and that's really what we're trying to help promote with FMPHA.
And this is what led to FMPHA partnering with A4M, correct?
Yes, exactly. We're really excited to partner with A4M this year in order to help further that mission of integrating more pharmacists into the functional medicine space. And so probably one of the most common questions that I get from new pharmacists in functional medicine is, how do I get trained in this? What organizations should I join? How do I network and meet other people in this space? And so A4M is going to be a really exciting partnership where we're offering additional discounts on membership, for World Congress attendance, and also for the fellowship modules to make it even more easy for pharmacists to get that training, education, and networking in functional medicine.
That's great. What a great partnership.
Yes.
It's been a pleasure talking with you today.
You as well. Thank you so much.
Thank you.